tell us what funding measures can be taken to ensure sustainable operationalization of the One Health Joint Plan of Action?
Thanks.
At country level.
At country level.
Yeah.
Yes. I think I would put three key elements there. One is to make use of the existing financing mechanisms. There are many mechanisms that are available, and we need to mobilize those long-standing mechanisms to bring financing to the countries. I think the second point I would make is to make sure that the mechanism is country-driven. We need a strong ownership in the countries. And not only we should bring development financing, but we should also make sure that there is co-investment, that the country invests also in those in the implementation of those plans, and also policy commitments, so that when the money runs away, we're left with nothing. So we need policy commitments. We need commitments under the form of co-investments. And I think that the third thing would be not to look at One Health as a new standalone thing, very vertical, as we've seen with the other diseases, but something that is clearly very well aligned with the development agenda, with addressing endemic diseases having really an impact on development. So there's a strong alignment.
Okay. You mentioned long-standing funding mechanisms. Would this be long-standing funding mechanisms in the country context or in the donor context?
I would say both, and institutions like the World Bank has those IDA, BRD mechanisms in place to finance development. And if we do this exercise of strongly aligning One Health with the development agenda, we can really mobilize those funding mechanisms. They have been there for many years. They will be there, and so we need to make the best use of that.
And where do you see the place of estimating or understanding the exact cost of One Health in this context of funding, sustainable funding?
And this is a difficult question, because nobody knows exactly what is spent on One Health. So we're working with a group of economists to better understand how we could assess the national spending on One Health, on prevention and preparedness. This is quite challenging, but cost is only giving us a sort of target. I think what is really important is to mobilize the financing, so bring the money in and work with a very good, very clear resource framework with clear targets and indicators. Yeah. And I think the joint plan of action is providing a good result.
That framework. Okay. What about the role of a monitoring and evaluation mechanism to understand how the investment has been utilized?
This is absolutely critical, because otherwise we could pour money and money without any landmark or navigation capacity. So those indicators will be very important. And I'm supposed that we have some of those indicators through the PVS pathway, for example. But we need a strong resource framework.
Yeah, and presumably there will be a monitoring and evaluation framework in the joint plan of action, do you think?
Yes.
Thank you very much for your time, Dr. Franck.